even the physical structure of your body changes. We've seen a host of people that had normal body weight for 40 years or 50 years, and suddenly their weight exploded when the phone company put up the cell phone tower 200 yards from their house, not even that close, 300 yards from their house. We've seen cancer rates shoot up the moment the network of cell phone towers was established in the house. We had a co-worker with us who had a son who was very, very sensitive to electromagnetic fields, and she lived here in Seattle, and he couldn't go to school because the schools at the time already had wireless installed in the schools, and he couldn't tolerate it. So she moved to Portland and then couldn't tolerate it there at all. Then moved over to Ashland, which claims itself to be one of the greenest cities in the world. And then when she Googled the cell phone towers next to the home that she had rented, she found that within 200 yards, she had over 90 cell phone installations that were broadcasting into her home, and her son was virtually going nuts. And then she moved out in the country, decided on homeschooling, and the boy's been doing well ever since. So after observing like some very very clear-cut clinical situations where people were affected by the nearby cell phone tower, we became very meticulous in asking people about their homes and looking at the literature. I got certified in building biology, which is the sort of science in Germany that governs these issues, where we learn how to use different instruments to measure these phenomena in the house. And the first thing that we noticed is that the most important time in the day when we are vulnerable to the influence of incoming cell phone radiation is the nighttime, when the parasympathetic nervous system is active and the sympathetics are withdrawing. That's when the damage is done, most of the damage is done. And so we moved very quickly in telling all our patients a set of instructions. So our patients have to turn off all the fuses at night. That decreases a phenomenon called body voltage, and I think I don't have to go into that, it's probably explained in another part of the video. We have people have to get rid of their cordless phones, because the cordless phones broadcast a signal 24 hours a day into the rooms wherever the person can walk and have reception. That is a very devastating radiation that was also tested in this Greek study that I just mentioned. It destroys the same number of proteins that the incoming cell phone radiation does from the outside, the cordless phone at home. So since 6 or 7 years, my patients are not allowed to have a cordless phone in the house. They have to go to Radio Shack, spend $25 for a corded phone, and that solves it. Then the last step that we do, that every patient gets to measure with the instrument from Gigahertz Solutions that we use, measure the density of microwave radiation in the bed location. That's measured in microwatts per square meter. And if that number, for me, if the number is over 5, it's an unacceptable sleeping location. First of all, we look in the house. If you find a location, there's eddies, we call that. There's turbulences created in the house where often you find a location where the reading is low. If you don't, the person need to use protection in the house. And there's 2 ways of doing that. One is a wall paint that contains graphite fiber, carbon fiber, and conductive particles that creates a Faraday cage in the bedroom. It's a pitch black paint that's put over other paint, and over that you can paint normal paint, and then that paint itself has to be grounded with a wire into the earth. And the windows are covered with curtains that use a silver-coated cloth that reflects the incoming cell phone radiation to the outside. Now, with that, in general, it's possible. Every place that we've looked at so far to bring the radiation down to the level where it's acceptable. Now, I want to roll this forward to the clinical picture. Half my practice is the treatment of autistic children. And we realized very quickly when we did this that there's 2 kinds of autistic kids, the ones that recover and the ones that don't recover. And the ones that recover are the ones that follow exactly this set of instructions. It is hardly done with the vitamins and with the other things that we do, with the behavioral therapies. They have a minor effect on it. The moment we protect the sleeping location of the child, the autistic children are recovering. Now, I can say that with great levels of certainty now for two reasons. One, because I have a large group of people that follow my teaching in Europe, and the Europeans, when they hear that, they get the idea and run with it. In America, unfortunately, especially the husbands have become a huge obstacle to this. Most American men never had more than 1 year of physics in school and simply do not have the understanding, but they have strong opinions without ever having understood physics. They have strong opinions about it, that this possibly cannot be true, because if it would be true and dangerous, the government would have done something. Well, you make your own opinion after watching this film. So what we did then is a study where we took 10 autistic children and went back to the sleeping location where the mother was when she was pregnant with that child, and compared it with the sleeping location of a mother that gave birth to healthy children. We had 10 mothers in that group, 10 mothers in this group, and in the group of the autistic children, we found that the measurements that we got for the microwave exposure in the sleeping location of where the mother was when she was pregnant with her child was elevated compared to the group of children that were normal. The same measurement we got by measuring body voltage. This is the exposure just to the ambient field, electric field in the home created by the electric wires in the wall. Found the same number, that the exposure, that the electric charge that is built up in the body was by the factor of 10 times more in the sleeping location where the mother was sleeping when she was pregnant with her child. And with that, the exposure to man-made electromagnetic fields has become the first factor that could be isolated ever in autism that could predict autism. I can go to the home of a pregnant mother now, take those measurements, and give her a reasonable assessment what her chances are to give birth to a child that will later be diagnosed as autistic. Now, as you can imagine, I was not able to publish the study. Nobody was interested. It was 10 children was too small a group to say something, even though the differences are so dramatic that even the 10 children led to a huge statistical difference. But I wasn't able to publish it because of the special interests that are now have found their way into the medical journals and the peer-reviewed journals. I think it's important to say that now the communications industry has become the largest lobbying industry in politics, larger than big pharma. In fact, by a factor of 3 times more powerful than the pharmaceutical industry, which used to be the most powerful arm, bending the decisions in Washington and in all Western governments for that purpose. So we weren't surprised when I wasn't able to publish these data, but it made us even more aware of the fact that we need what is called preconception healthcare. If somebody is planning on becoming pregnant, moms and dads need to know this information, that they have to protect the sleeping location of the mother from these fields that are absolutely tweaking the epigenome and the genes of the fetus that grows in there, predicting that this child will never reach its true genetic potential later in life because these early exposures. So one of the points I'm trying to make here is, if a fetus is exposed to microwave from cell phone radiation or from ambient man-made fields in the house, the fetus is affected by a factor of hundreds times stronger than a grown-up, fully grown-up brain, even though it's not harmless for the grown-up brain, but the damage is somewhat contained.